Hi, Shubham and Gaurav. Welcome to the podcast.
Thank you. Thank you, Bala, for having
Yeah,
us.
for having us.
Great. So you guys are the co-founders of BigOHealth, and we are going to dive deep into what BigOHealth does and how is it making an impact. But let's start with a bit about the two of you. Let's start with Shubham. Tell me a bit about your background.
So I'm Shubham, and I come from Muzaffarpur. It's a district in Bihar, and our family is basically a farming kind of a family. My father is a farmer, and from childhood, probably I wanted to become an engineer. I don't know why, but I just wanted to become one. Couldn't get into IITs, so uh, joined a private college in Greater Noida. Before joining the college, I thought that I would be some electrical engineer or something. While the day I was supposed to decide my specialty, if it is called a specialty, I don't know what the word for it. I thought I will be doing computer science. Before that, I had zero idea what computer science is. So once I got admitted, because it's a private college, it was kind of a direct admission. Then I searched what is computer science. And yeah, this is about me, I guess.
No, coming from a place like Muzaffarpur, I mean, so I went to NIT Jamshedpur, so I'm kind of familiar with uh, the area and the demographics there. I do notice that a lot of people tend to migrate after their 12th. People moving to VIT, people moving to Delhi or even Bangalore for their bachelor's. Is that still the trend, or do you see that changing?
It is still the same. It's still the trend. People still migrate these days also. I mean, uh, we do not have such infrastructure and everything there back there. No? So yeah, it is even during COVID, a lot of people went there, but now they are again coming back. So it's
Hmm.
not just about the job, right? The kind of lifestyle we can have in a bigger city matters to younger people coming from a small town. No? So, yeah.
Yeah. Yeah. That's great. So let's move to Gaurav. Tell me a little bit about yourself.
Yeah. So I'm starting with how me and Shubham started our journey. So like in 11th, after like everyone want to crack the IT JEE, IT JEE. And it's very surprising that I and Shubham are into the same batch, same classes, same coaching institute, that's the Bunsen classes. And I hope our batch was B8 or G8 or 11 bullseye,
P,
right?
P.
It's P11. We were together and like, but we never interacted with each other. And when we got admission, like same college admission, same section again, but again we are not knowing each other. Like uh, I used to sit this side and Subhan was this side, but only the interaction was we used to validate our answers in the either in mathematics or in the mechanics. So whatever, like I used to travel, like so used to live in a hostel. I used to travel from my home, and when our section changed in the second year, and again we got the same section, that is the biggest, you can say, the
Serendipity,
best
kind of.
thing happened to us, otherwise we are not together. So I called Shubham because I never saved Shubham number. I don't know if he has saved or not. He might not have. So from the college group I take the number and I called Shubham ki just take one seat for me, because I don't know, from the college days I have a tendency to sit in front of, I don't know, on the front bencher. I was to I said I must Shubham ki just take one seat in the front bench and we'll find. Then from that day we start talking about like a startup ecosystem, how the startup ecosystem at the time, the various, the stories like your stories and other articles and publications were there, and we used to read the same story. So this brought us closer, and I don't, if I'm not correct. So one day I and Shubham at my place, and whole night we discussed an idea. So literally, we used to sleep at like 10, 11, and in the like early morning 5 or 6, we keep talking. And next day we went to the college. So yeah, so once in the college we got a chance to visit EMS for college kind of competition, used to hackathon kind of competition. Then we wanted to build on the something from the healthcare side. Then we visited, like we are earlier we were thinking we will build us something like the toothbrush that will send the real-time diagnosis to the dentist, and then we something with kiosk type of thing that monitor all the body vitals and send to the doctors. Then we got a chance to visit EMS for that resource purpose, and we saw that a number of people are there being vulnerable for to the exploitation by the doctors and basically for the middlemen. And this inspired us to build a solution for them. And this is how it works. BigOHealth was born. And
Mhm.
that was at that time we were in the second year for college. Yes.
Yeah, tell me a little bit about these middlemen. Like, what are you hinting at?
So see how
So
it
look,
works in the healthcare. So at the very first point of everyone want to go for a right hospital, but at the way, if you visit any hospital like EMS, RML hospital or GTB hospital, any good hospital in India, you see there are people playing around, just watching the people who are in the hurry of getting the treatment or in need of treatment. They misguide them. Okay, okay, no, you have to wait there. The appointment will come after a month, or yeah, the radiology services will be observed after 6 months, and they misguide the people and take to the hospital of their own choice, where the quality is not good. Also, the exploitation is very high. So this is basically their task, and that happens from the primary level to the high tertiary level. Even if you see in the rural areas as well, so the people like these. So in the middleman, that is called unqualified medical practitioner, that is quacks, that is very popular in India. So they will basically decide the patient journey. Yes, but that should not be there.
Okay, so the way I understand is at centers where people should be getting free treatment or treatment at a lower price, there will be these so-called middlemen hanging around and be like, hey, there's a long wait, and they will exploit them and be like, hey, I know this hospital where you can be treated fairly and much quickly, and they'll probably get a commission from the doctor or that
Yeah.
hospital in a sense.
Yeah.
Okay, wow, that's a crazy thing, and I'm sure it's very common in even government offices, right? Like I think there are people hanging out in front of like probably the secretariats or the places where
Yeah.
you get things
We
done at
have
the
never
capital.
experienced that, but there might be.
Okay, that's very interesting, and I think that is a real problem because a lot of these patients might be coming from economically underprivileged backgrounds, and they probably do not know what is the right place to go, what are the right doctors to visit, because all they know is, hey, if you are sick, you just go to the hospital and they just treat you, right? um, Now, coming to how Bigo Health was born, so you talk about how a visit to AIMS kind of sparked this idea. What was the discussion post that with Shubham and you on what can be done by leveraging your background in computer science and marrying it with healthcare?
look. So earlier, as Gaurav mentioned, we were trying to develop something called IoT. IoT was a buzzword at that time. I guess still it must be. Because buzzwords never change. In engineering college, computer science, buzzwords never change. I was recently interacting with a third year student, and she was telling me in second year, her teacher had recommended to write some papers, which was done to us also. So I don't think buzzword has changed a bit. Uh, but once we started visiting these centers like AIMS and Safdarjung or other center, and once Gaurav went to Motihari, and there he talked to, I mean, we wanted, look, Bala, we there is never a spark or some sort of incident where you got an idea or something. This didn't happen with us. We were already a team. We were running a social help group at that time named Donation Club. So I briefly talk about Donation Club a bit. So what Donation Club was, once Gaurav was coming to hostel again, I used to live in hostel, he lived in homes. as it happens in engineering college, we study only before exams. Okay. So he was coming for some exam. And it was winters. And if you are aware with this UP bus, they do not have windows mostly. At least at that time, they didn't used to have. So he felt cold because he was not carrying any sweater or anything. There we decided that, yeah, there are many such people in Delhi who are, basically sleeping on roads and everything. So we thought, let's do something about it. But we were, look,
No,
from day one, we
at
were,
that time, so if you see the Greater Noida, it still is under construction. So around our hostel, like there are so many, laborers are there, their family and everything is there. So we thought that if we are being a privilege in a, in a heater room or, within a wall, we are feeling such cold. So what about those population? Because if you go outside, you say that, some bulbs are lighting there and people are shivering in the cold. And the same day we built a website, same night we built a website from our savings, 13
yeah, we
1400 rupees.
collected money from few people, and we purchased
uh,
one domain, donationclub.info. But we understood, look, if you look around your home, still today only, you would also have many things you could donate. But there are mainly two, three restrictions why someone do not donate something. First is you have only one weekend, right? So you will be spending time with your family and all rather than donating something. Second problem is, suppose you are motivated enough ki chalo is Sunday ko we will donate something, but you don't know where to donate to. Okay. And third problem, which we understood, when it comes to donating something, the gen inside us just rises. कि ये तो मेरा donation best use होना चाहिए, right? Although it must be rotting in a corner in your home, but once it comes to donation, you think कि ये तो best use होना चाहिए. So what we thought, what if we build a platform where you request a donation? We will go to your home, collect their stuff. We will donate on your behalf, and we will update you where we have donated these things. And we will do it everything for free because the name was Donation Club itself. Okay, so this is how we started with Donation Club. So again, we already had a team. So we also, although it was a small thing to do and everything, but not in terms of donation. I mean, it was not a company, right? We had just one website. We just used to call people, go there. But many things happened during those times also, like management among each other and everything. So we had got a taste of how companies work. Okay. So it was not a single incident which sparked us to do anything. So again, as I was telling, Gaurav went there to Motihari. There, the situation is even worse. So we thought, okay, IoT, deep tech, we will do at some point of time. But first, we need to build something very basic solution where people can at least, we will onboard doctors and people can at least book prior appointment. Appointment to choro, at least people will get to know if the doctor is available in the city or
The
not.
city or not, yeah. Because
So this is
the
how,
area we operate in, if you see, if you go there, still I'm talking about 2024, people visit the doctor clinic even 1 a.m. in the night or 2 a.m. in the night. Just imagine your mom or your dad is sick and you are visiting the doctor clinic 1 a.m., how hectic it is. So just because they see that, yeah, I need to see the doctor today, and that is only a GP doctors. I don't think so. Okay, for a GP you have to be outside the doctor clinic. Instead, you can do a teleconsultation. So after visiting so many doctors and so many cities across the Bihar and Uttar Pradesh, we saw that situation. Like everyone is trying to build the appointment booking solution around the metros, because what happens if you are new into the metro cities, you don't know about the doctor geography and everything. But what about the population who are more vulnerable, more underprivileged? We must build something around that. The we started with just a simple appointment booking solution with the three screen in the screen, and it was a very great incident. Like we in the final year, we were like just 5 6 people on a flat doing some chit chat and watching some Mirzapur release at that time. We were watching that.
Mhm.
And
Sacred Games.
Sacred Games, yes, Sacred Games was released. And what we thought that let's go to Bihar And one of my friend named Dhananjay, we asked them, ki, are you joining us? He said, okay, you have to bear our, things. I said,
Expenses.
okay, no issues. At the same time, we called one of our professor, that is Gaurav sir, a very, very respect for him. And he asked me, just take my credit card and go and do whatever you want to do. We take 40,000 rupees from him, and we went to the Bihar with 3 screens only of the website, and we onboarded 10 doctors. And
What
each
did
doctor,
you, just on that, like, what did you tell them and how encouraging were they to this idea?
yeah. So we just went there and we say that we have a brief background. We are software engineers trying to build something around appointment management, so that people don't need to travel and all. And also at the same time, you are getting visibility among the more remote areas. So this inspired us to build a solution. And again, there are some doctors who want to give back to their society. And still I remember, we earlier we used to charge 1000 rupees for a one time onboarding fee. But one doctor, Dr. Abhishek Tiwari, who is our been to our mentor since that day, and he called us from the just dial, and he gave us 4000 rupees. And we are very sure after that incident, if everything goes wrong or we are like lack of fund, we'll dial his number and he'll arrange something. So we onboarded few doctors from Muzaffarpur, and then we again came back and we make a mistake there also. So we came back, we did our college studies, and like one incident happened, like in the everyone want to do complete the engineering. So in the college days, we applied to the American embassy, that's a program called Nexus. And I met that guy in Europe, and he liked our idea, like social cause and everything. He invited us to apply the form, and we applied. And suddenly the result came on the final day of our examination. I and Shubham were traveling, and the time the result came, the mail, because there are some certification from UT University on Texas and all. So we looked each other face with a very happy face and said, "Ki exam chhod de kya?" In the bus, middle of the bus, and we said, "Ki no, no, yaar. If we skip the exam, we have to go again college for the next 6 months. चल देखते हैं." We went there, we write the paper, and again the connection. So this is how Pico Health was born.
Wow. That's fantastic. And I mean, I'm glad you guys finished the exam
Yeah.
because it was like 99 per run out. So wouldn't have been nice. Okay, so great. So you went to Bihar and you onboarded these doctors, and you basically charged a fee for onboarding.
Yeah.
I just want to digress a little bit and talk about the monetization, just for the sake of the audience who want to know how this actually works. So I am a patient and I want to seek the help of BigOHealth for consultation. So I go in, and I look for experts in my area and book an appointment. Um, do you offer a service where I can go visit them personally, or is it all telemedicine?
No, so uh, earlier we were doing just in-person appointment booking. As Gaurav mentioned, people were waiting outside clinic. So we started with you can book appointments so that you need not to wait. So that is still there. So earlier, just appointment booking was there. Okay. Now during COVID, we started doing teleconsultation, that means video consultations also. Now we have everything related to healthcare. Like we have lab tests, we have second opinion, we have surgery facilitation, right? Everything except for medicine delivery, we have you can record, store your health records and all. So these are all the things which you can do. Teleconsultation is just kind of an assistant. Look, for a super specialty care, just to give you an example, suppose you consulted with a neurosurgeon in person. He gave you some tests and all. So what we recommend, you need not to visit him every time. So next time you can do teleconsultation, or first you do the teleconsultation, and if need arises, you can go visit, meet him in person. About the monetization part, yes, we have been charging from the doctors from day one. Uh, but from the patients, we started monetization very late because we didn't want to charge from the patient earlier. So we run it for a year or so. We didn't charge patient anything. Then we started doing experiment around charges. Like we started with just 8 rupees for the appointment facilitation. Then we went to 12. Then we went to, and look, these was not for our revenue or anything because Razorpay charges us 2.5% approx for every transaction. Okay. So that was to recover that 2.5% only. And then we started charging 20 rupees, now 20 to 50 rupees for appointment facilitation. This is in person. If you have to go meet doctor in person. So that is our charge. Apart from that, we still charge from doctors for onboarding fee because we put their profile. They have an app where they can manage their appointments and clinics and everything. Then for teleconsultation also, we charge from the doctors only. It varies from 10 to 50%, whatever. I mean, we charge from the doctors only. Lab tests, we have collaboration with some nationalized labs. So there we make money. Same goes with surgeries. Although we have a subscription also, it's a family health card where our goal is to provide a virtual family doctor to every family. So these are the ways we make money from.
Okay. And I think a common question that may come up with in everyone's mind is, what is the actual incentive of the doctor? Uh, why he or she would put their name on BigOHealth? Is more visibility the incentive, or is it more patience the incentive? Because, in general, I hear that, doctors in India, we have a shortage of doctors, and doctors are usually overworked and overburdened. So, walk me or tell me a little bit about why someone would want to register.
Yeah, yeah. So see, how we onboard the doctor. Basically, we have categorized the doctors. There are in a like outer line, we have three category of doctor. The first one is the senior doctors who are very famous, practicing like 20, 25 years, 30 years. That are very few in the town, like let's say 8 or 10 doctors in the town. Second, doctors come to the mediocre doctor, like having experience of 10 to 15 years. And they have grown their service because they want to, become a brand like their senior doctors. And third category comes to the early doctors who are just starting their practice, just graduate and did their MBBS or MD or whatever degree they have. They want to grow their business and basically build a presence around their city. So our pitch for these three doctors are very different. For the doctors who are very senior, the top one doctors, we pitch them ki, this is a facilitation, extra facility for your patient, because they want to, at this time they do not need patient, but they want to give back to the society and everything. So we facilitate with that, okay, your patient do not have to wait in this digital era. Everyone is getting online, and they are also aware ki, online is something happening. So we pitch this to the first doctors. The second kind of doctor we pitch to that key to build a digital reputation, because either way they are connecting with the conferences, Delhi, Mumbai, and they are saying that digitization is happening here, UPI is there. So also they are aware that the people do research on the online. So we give them like to build your digital presence there. Also the facility to your patient. Also, to reach to the remotest location. For the new doctors, to category 3 doctors, we pitch them you'll have a visibility among our users, whatever the users they search you, because you'll do marketing, whatever the PROs that you will hire, that requires a lot of money. But with our solution, you can in a one go, we build your profile and probably that you can reach out to the whatever the users I have. Let's say from a city we have 30,000 users, you can quickly reach to the 30,000 users. So this inspire all the three category of doctors to reach there.
Just on that note, about new doctors and PRO, is that a thing where, I am a fairly new doctor bursting into the arena? Uh, is PR a thing among doctors as well?
Yeah,
PRO. Yeah, look, doctor's life is very difficult. First, they have to study for so many years, and they are also an entrepreneurs. So one of the things which we tell to our people who we wish to, don't look at doctors as numbers. I mean, just they are not individual doctors. They are entrepreneurs. For example, let's talk about a single clinic. Like there is a doctor, he or she has few staffs to manage. If I mean, I remember I went to onboard one doctor, and he's a very senior doctor in his town, and someone was fighting over cleanliness. Okay, झाड़ू नहीं लगाया कुछ like that, and that doctor was supposed to solve that issue, and he had studied from BHU and everything. So these doctors, they have to do all the marketing things to get patients.
Very interesting. Great. So now let's look at the patient side. So the patients go into the app and they can find doctors, and I'm sure there are ratings and specialty and where they have graduated from, etc., etc. So do you see a risk of the most famous doctors or the top-rated doctors just getting overburdened with patients, and the others, obviously they'll have no appointment slot, so obviously there'll be a little bit of trickle down to the fairly newer ones. But if someone is starting from zero, how hard is it for them to build a reputation if they are not coming from, let's say, an AIMS or one of the top universities? Because I see that you guys do mention where they graduated from, which I think is very, very good, because a lot of the times the patients are unaware of where, like, what university the doctor came from. Though I don't believe in the fact that you need to be from a good university automatically makes you a good doctor. I think both of them are completely different. But from a patient side, how do you? Uh, okay, let's talk about the doctor side for a little bit. So, how does a doctor straight out of school or a college um, sort of make their mark? Because wouldn't they be thinking that, hey, all the top doctors are going to get all the patients?
Yeah, you pointed out right question. Like everyone in the start, they do struggle with. But one thing is very sure with our platform and in the core of our uh, platform, we only curate doctors. We do not onboard each and every doctors either in primary care or a specialist or the super specialist care. We have a different curation mechanism based on the 18 parameters in our app itself, and again we ask for the referral and recommendation, and we either me and Sumam or our team visit them and ask due diligence before onboarding them and listing them on the platform. And talking about the new doctors, the problem of the new doctors, yes, first of all, they want to, build the visibility around the time. And we ask them, the doctor we onboard them on board, we ask them to conduct health camps in collaboration with us, with our digital centers, so that in the next 6 to 8 months, they can build a reputation at the one-to-one connection by seeing the patients, and they can, make their reputation around the town.
Okay, that's great. Tell me a little bit more about these health camps.
So
Yeah.
in
So
yeah,
we have look, ours is a platform, right? Anyone can download and use it either through our app or through website. We have a helpline number also, but irrespective of how tech savvy you are, when it comes to healthcare, many of us want some sort of handholding, right? So in order to provide first that handholding, and second, someone who is not that technically sound, we have our centers also, physical centers in villages. We do it in collaboration with pharmacies and all. So what we do, suppose if you are a doctor, suppose if you are a super specialist, you came to a city, you are a new doctor, you got onboarded to our platform. And if you want to do health camps, for example, look, how does a doctor get his or her first patient? Okay, you are a new doctor, you come to a new town. How do you get your first patient? There are 2 3 things which can happen. First is you have a good social media kind of a presence where, and you started to, suppose there is a doctor and he has started to say visit in Motihari, one of our operation area. So if they have already a social media platform, they can start announcing, look, from this time I am going to have you in Motihari. That is the first thing they can do. Second is you will find some senior doctor or some neta kind of a person, and you will bring them to your opening of your clinic. Okay. Third one is you will find some local connected guy and hire him or her as your assistant or compounder. This, or you will collaborate with some pharmacies who have a high kind of a intake of patient, and there you will collaborate with those centers. These are the ways in which doctors get their first patient per se. Because look, doctors mostly get patient through referral, word of mouth only. Most of the doctors get patient through word of mouth. So our goal is to maximize this word of mouth. Okay. For example, the 4 or 5 things which I talked about, this is you doing something, right? And there are a lot of chance involved. There is a if you are lucky, then only you will be able to find some good compounders, for example. What here we are doing, again, we are increasing your surface area of serendipity. Basically, we are taking you to those villages. We are telling you, look, this is our center. You can go there. You can do some sort of camp related to your specialty. This center guy will ensure that some patients come there because they are present in that village. So this is largely how this health camp works.
Okay, that's great. So basically, if a doctor had a sphere of influence of, let's say, 50 to 100 kilometers, you are increasing that sphere of influence to probably all over India. So that is giving them more visibility and more chance for them to give their services, which, now that I think about it, is actually beneficial to tackle this problem of lack of doctors or overburdening, because it sort of smoothens it out, right? Like, so if doctors are overburdened in one particular city, then, doctors from the other cities can probably jump in and sort of share that load a little bit,
Yeah.
which is great. Now, I want to dive a little bit about data protection. I think patients will always be curious about something that happens digitally, and we hear all kinds of stories about how data was breached, etc., etc. What are you doing special about the data protection of patients, or do you handle patient data at all? If you don't handle it, then uh, even better, because you are not responsible for it.
Yeah. So for data protection, look, as of now, apart from your health records, we just take basic details which a doctor needs. Like, if you go to book appointment with a doctor, patient will ask for your name, phone number, age, address, right? These are the only details we are taking as of now, right? So we have made sure that your data is encrypted in transit. We have several backups. Most of our servers are in India only. We use AWS for almost everything we do on cloud. These are there. Apart from that, since now we are integrated with ABDM, we have got some first set of licenses there. So ABDM is Ayushman Bharat Digital Mission. It's a government initiative for digital to making healthcare. Basically, you understand that this is UPI kind of a thing for health. Okay. So since we are integrating with them, so they already have many standards in place, right? So again, if a company wants to be compatible with ABDM, you would have to follow everything that is under the guidelines of that NHA. So we are doing that already.
Okay, that's fantastic. And before we wind up, I want to touch on how you guys built the team, and also the kind of development effort that a company of this size would require. So tell me a little bit about how you guys went about hiring and finding people with right skills, and the kind of team you have.
So see, like in the start, you do not have any idea how to hire the team or build the team. You just post on the pool. Earlier, however, because I still remember when we are building our app, because we are not comfortable with the UI. None of us are from the design background. So for the UI, we are not sure how to get the right, candidate, or so we had agency for that, and that UI was so cheap. I can't tell you or explain you about that. So somehow we posted on in our college group, and we saw that 100 or 200 application came in the same day for the same UI profile. Then we thought that something can be worked. Then we posted on in Intershala, interviewed. So in the starting, uh, we did some mistake, but we hired some candidates from the IT Madras or IT Trichy during the COVID times. And I'm sure that those guys were interns only. Then with the experience and our needs and whatever the problem we are facing, we listed it down and build SOPs. Okay, whatever the criteria we are looking for, the first criteria that we look for in a team, especially that's whom we hire for the full time, is he is same crazy about us or not. He want to do 24 by 7 or not. If someone is not available 24 by 7, we don't need that at this stage. So this is how we build the team. Currently we are 12 people, and I'm sure if you call 2 a.m. in the night, any of one will respond your call and connect you with the doctor. So there was a story. It was around 11 or 11:30 in the night, and one of my friend was traveling from train, and two or I think less than 2 years old baby was crying in the train, and the mother was in panic situation, and she needs a pediatrician at the time. Luckily my friend called us, and I think Shubham picked the call and connected with the doctor within a minute, and we got doctor guided the patient inside the train, and the after the consultation baby stopped crying. So this is how our team is, very responsive and very active.
Hmm. What is the split up of the skill set of all these 12 people? Like, are they all software engineers? Like, what kind of backgrounds do they come from?
We have people in development. I mean, development as in designs of Android and backend, not backend, front end. I look into backend yet. So, and then we have people from business development. We have people in support. But our people in support are a bit trained about medical terminologies and all, because they need to understand. Uh, we put a lot of focus on taking feedbacks, because look, in these areas, doctor doctors do not have resource to take feedback from you. How was your experience? Because they do not have trained staff there. And our goal is to take 100% of the feedback. If you are booking appointment with our app, you are booking consultation, whatever you do with our app, we make sure that we will take feedback from you. So we have people whose job is to just take feedback uh, and resolve any of the issues, which we have resolved many smaller thing, like fixing some food issue in canteen in a hospital. There was very interesting. One of the patient, we got a review that at some clinic, at some gynecological clinic, the husband was not very comfortable with there was not such opaque uh, place where the patient was examined or anything. Probably he saw some male being traveling there or something. So, and that doctor has been practicing since more than 30 years. And it was the first time she got some sort of complaint, and she actually went ahead and fixed it. So we put a lot of resource there to take feedbacks. Yeah.
Hmm. Yeah, this also makes them more, I would say, uh, like take responsibility when it comes to things like procedures and cleanliness and hygiene and so on, and it makes things a lot more transparent. And to your point about how you hire talent, I think this is something that I hear across the board from all entrepreneurs, and I had a chance to talk to the co-founder of Wondercraft AI, which is like this platform. So they did go through Y Combinator and so on, about how they hire their first engineers. And the answer is always, yeah, it is difficult to sell. uh, Compensation and salaries is not what they sell. They're just looking for people who are just as hungry as them, who are uh, just as aligned to the idea of the company and what they are trying to accomplish. And that's pretty much it. And it's not that it's difficult to find such people, but if you find 5 6 people, I think that's a job well done. So I'm glad you guys are on the right track. But it was great talking to you both. I think BigOHealth is looking to accomplish a very noble mission, and I wish you both all the very best.
Yeah. So in the last, I want to conclude like it. So we are not just doing the appointment facilitation, because we talk more about the rural areas. We started with the appointment, in-person appointment. Then we slowly moved out to the teleconsultation. Now with the customer feedback or the need we saw and the pain we saw, what happens in the specialist and super specialist care, especially in the surgery care, what patient do? They visit their hometowns, like their home capital, let's say Patna, talking about the Bihar population, UP population, Lucknow, and finally for the tertiary care, they comes to Delhi. And Delhi itself is a very, big city. And even we are from here and we got where to go, how to go. And so we built a solution around that. We curated the doctors from here, Delhi. And what happens, like, if we fall sick, our major choice is go to any big hospitals. And we went to the hospital, but who decides the doctor? Simply Google cannot decide the doctors now. For your disease, your friends or family cannot decide the doctors. And so this is one of the major challenge we are tackling. We curate the doctors, the parameter we spoke in the last few minutes, and we facilitate end-to-end care. Let's say your test, diagnosis, like scans, radiology services, pre-surgery care, surgery, in-person surgery, and basically the hand-holding support. Either, let's say my mom is sick or your dad is sick, what you will do or I will do for my parents, the same our team will be do for your parents. So you don't have to worry about anything. You just come to our platform. We will take care of pre-surgery care, surgery care, and post-surgery care. And if you went back to your towns, we will facilitate the tele and video consultation with the doctors, and so that everything can be streamlined at one place and very smoothly, because we understand how it feels when you need a doctor and you are getting delayed by 1 hour or 2 hours. You just need to wait 1 or 2 hours. We understand that pain, so we are facilitating that. Yes.
Yeah, and as someone living here in America, I completely understand how difficult it is when you are just not able to find an appointment or get a doctor of your choice. Yeah, there are emergency services and so-called urgent care in the US as well, but you have to chop off your arm and leg or probably sell your kidney. So, um, thank you both. It was really great getting to know how you guys started and are in this amazing journey with BigOHealth. So thank you so much.
Thank you, Bala.
Take care.
Thank you, Bala, for having us, and all the best for your this podcast.
Hope
Thank
your podcast will grow and reach organically to more
you.
users.
Hope
Yeah.
so. Yeah. Thanks to you all. Yeah.
See you. Bye.
Bye.